Republicans promise to restart the health care debate. When they take power in the House next year, they may not need to repeal the law if the courts stand in the way. Our next guest wonders what might happen if either challenge is successful. Boston University economics professor Laurence Kotlikoff writes about the fate of Obamacare in his latest Bloomberg column. He's also the author of The Health Care Fix, and he joins us now by phone from Boston. Professor Kotlikoff, thank you for the time. And let me ask you off the top, are you worried that the health care plan isn't going to be able to survive these challenges?
Well, yeah, I am. It's either the courts or the Congress that may undo it, and that's going to leave us in a lurch because 1 in 6 of us have no health insurance, and these people need health insurance. So, we need to have everybody have a basic plan. I think there's basically a general consensus in both parties toward universal health insurance. The real question is how to do it, and the concern with Obamacare is that it's just too complicated and too expensive, and it doesn't get control of the rest of the system that's out of control, Medicare and Medicaid, and the whole thing's going to drive us broke. So we need to get
So you're not satisfied this was the answer? You had, as I know, you had some of your own ideas.
Right. Yeah, I'm proposing something called the medical security system. It's very much what they have in Germany and Holland and Switzerland and Israel. It's exactly it's a proposal for everybody to get a basic health plan, and it's also very similar to what Paul Ryan and Alice Rivlin have just proposed, just with respect to Medicare. But the basic idea is everybody gets a voucher based on your pre-existing condition. So if you've got bad genes or you've had bad luck with your health, your voucher is going to be bigger. You use the voucher to buy a health plan. And the health plan coverages, what's covered by your health plan is set by a panel of doctors, called a death panel or a life panel, whatever you want to call it. But that set of coverages is such that the total sum of the voucher, the cost of all the vouchers to give everybody this basic plan, stays at just 10% of GDP. Now, if you look at all the spending the government, federal and state, are doing on Medicare, Medicaid, and these tax breaks for employer-based health care, and also this new what the president's proposed, all that together sums to about 10% of GDP. So this is a very efficient proposal for providing a policy for everybody at 10% of GDP. I think it's what the House Republicans should go for.
Do you think there's a realistic chance here that, particularly if these legal challenges are successful in Virginia and elsewhere, that there could be a second look here, a second opinion on the president's health care plan? It is the law of the land right now.
It is the law, but if it doesn't get funded, then it's not going to really matter, even if it is the law. But then the Republicans are going to have a problem on their hand, which is 1/6 of the population will have been deprived of health insurance that they would otherwise have had. So that's not going to be a good answer either. We need to fix this thing fundamentally in a way that doesn't drive us bankrupt. So there is a middle ground here, a purple solution that the president, as well as the Republicans, can embrace, which is the medical security system I propose in the column.
All right, Professor Kotlikoff, we thank you for the time. Bloomberg columnist, Boston University professor Laurence Kotlikoff joining us from Boston. We should note the opinions are his own and not those of Bloomberg Television.